Okay, now we look at the novel pathophysiology behind this heart failure. A healthy heart pumps what it gets. What does it mean? Whatever it receives from it veins, either pulmonary veins or vena cava, superior, inferior vena cava. All the blood it receives, the heart pumped out. There can be some residual volume in the ventricles, a small volume, but this residual volumes remain unchanged. That means heart pumps out all the blood it gets through the veins. So what happened in heart failure? In heart failure, heart cannot be able to pump all the blood which it receives from the veins. So there is a stasis of fluid inside. The residual volume going to increase little by little. This is we call heart failure. I'm not going to list the causes behind heart failure. You can find it out all the textbook and even the websites. Instead, I'm going to focus on the physiological changes during heart failure. As you know, there are baroreceptors, we call baroreceptors inside aortic arch and the carotid sinus. There you can see baroreceptors. Baro mean carotid sinus. These places you can see baroreceptor. Baroreceptors mean pressure receptors. It sends the pressure inside the blood vessels. When the heart starts to fail, that means it can't pump as it was before. So the pumping ability is reduced. So the pressure going to be reduced. Okay. Even though the blood volume is unchanged, the patient has got adequate plasma and blood volume inside, the baroreceptors going to sense that there is some kind of pressure reduction because of the reduced pumping ability. This pump is not working properly, so it feel kind of reduced pressure inside. So inside the aortic arch and the carotid sinus. So what happened when baroreceptor sense that there is low pressure inside? It stimulates the sympathetic nervous system. At the same time, it reduces the parasympathetic outflow. So when the sympathetic system is stimulated, it produces more adrenaline and noradrenaline, and it come into the blood. At the same time, it reduces the parasympathetic outflow and increase the heart rate. There is increased sympathetic outflow, there will be increased catecholamine. That means adrenaline and noradrenaline. This adrenaline and noradrenaline increases the heart rate and the cardiac inotropic effect. It try to increase the pumping ability of the heart, this adrenaline and noradrenaline. At the same time, it produces vasoconstriction in order to increase the blood pressure. This is how baroreceptors react. At the same time, due to the reduced parasympathetic outflow, heart rate tend to increase. In addition to this, the pressure reduction due to the failed heart pumping ability, the pressure reduction due to heart failure not only sensed by these baroreceptors but also inside the kidney. Inside the kidney, because heart cannot pump adequately, so the renal perfusion also going to be reduced. At the same time, when the sympathetic outflow increases, it produces vasoconstriction. Because of vasoconstriction and also due to the heart failure, the renal perfusion going to be reduced. This in turn activate the renin-angiotensin aldosterone system, RAS system going to be activated. When the renal blood flow is reduced, the renin going to be higher. This in turn activate the RAS system. They have found beta 1 receptor inside the kidney also. When the beta 1 receptors inside the kidney activated by this adrenaline and noradrenaline, it increase the production of renin. That means it increase the activity of RAS system further. When the RAS system is highly become active, it going to produce so much aldosterone. Aldosterone try to keep the fluid inside the body. That means water retention occur in response to high aldosterone level. Now you can clearly see that because of the physiological response to the heart failure, the heart failure condition become worse than before. That means this will become a vicious cycle. So if you want to treat that patient, we must break that vicious cycle somewhere at some point. So this is how our current regime, our medical management strategy, focusing on breaking this vicious cycle.